according to the
Basically, we stop when the spinal column segmentation stops at the top or bottom. Yeah, because in T1 and L5 are very actively segmented in the spinal column. Yeah. Yeah, thanks.
Okay, thank you very much. Then let's move to the next presentation. The next presenter is Dr. Eric, who is an associate professor at University of Paris-Est, Créteil, and permanent researcher at Images, Signals, and Intelligent System Laboratory since 2017. Had the master signal and images in medicine. So today, Dr. Eric will present a paper titled "Speedy transformer-based approach for bipolar disorder classification using audio."
Thank you for this introduction. So today I will be presenting research work of my master's student, Mohamed Ramadan, who just started recently his PhD. So this work has been during his 6-month internship. It was in a collaboration with Seong University in South Korea. Azem and Musakim, they are the co-supervisor of this PhD thesis. So today I will be presenting our paper, Transformer-Based Approach for Bipolar Disorder Classification Using Audio. So this research work is a complementary approach to computer-aided diagnostic systems. So this research work actually, or our approaches is complementary to medical imaging. So we are developing a computer-aided diagnostic system using different modality. We are working using video. We use also EEG, ECG, and multimodal approaches. So I hope it's a bit different of what it has been proposed today. So I hope that you will enjoy our work. Okay. I will be starting by talking about mental disorder. So we have 38.2% of European population, which is affected every year by psychiatric disorder, according to the World Health Organization. So mental disorder is the world is leading causes, first leading causes disability by 2020. People with mental disorder illness die early at 20 years on average. So we have nearly a third of all people with a long-term physical condition, also which have mental problems such as depression or anxiety. So people like, for example, who have cancer, probably they will get also a depression during their illness. So mental illnesses account for nearly as much morbidity as physical illnesses put together. We have every year nearly 80,000 people which commit suicide worldwide. In UK, for example, we have 60,000 per year. So suicide is the second cause of suicide death for youngest people between 15 and 29. So to answer all these problems, in my research team, we are interested in developing computer-aided diagnostic system for diagnosis, prognosis, assistance, and also follow-up of people who have a mental disorder. Okay, so we have been developing a lot of work for clinical depression, for post-traumatic stress disorder, for ACD for children, and this is a recent work that we have started for bipolar disorder. Okay, bipolar disorder, he has a second name in clinical terms or medical terms. We are talking about maniac depression. So bipolar disorder, it affects 46 million people around the world, which include 2.8% of US population. It has an extreme mood swings, normally with the three phases. The first phases, which represent emotional heights, we call it mania or hypomania. We have a lows that we call it depression, and usually there is a high confusion between clinical depression or major depressive disorder and mania in this episode. And as I explained, it's the second cause of death for youngest people. So the advantage, if we diagnose early bipolar disorder, the patient might gain a mental stability, okay, at least. So we have 40% of the people with bipolar disorder, they are misdiagnosed, and those people usually they are confused with the clinical depression or major depressive disorder. We have a symptom which overlap between several mental disorder, like depression, and usually we have a confusion between depression and bipolar disorder. Today, we have a lack of standardized medical method of diagnosis. There is no medical test like blood test or MRI or something like this to diagnose bipolar disorder or other mental disorder. Usually, we use a self-assessment questionnaire. So when a person goes to the doctor, he will ask him a set of questions and he will give him each time a rank, and the sum of this rank would represent the evaluation. So those self-report scales or inventory diagnosis, they have a lot of limitation. It depends from one country to one hospital. We change the way of diagnosis mental disorder. Like for example, for bipolar disorder, we have structured clinical interview, we have mode disorder questionnaire, we have general behavior interview, and other. So we have so many scales proposed. So our objective is to propose a new biomarker or signature for more accurate bipolar disorder diagnosis, is to propose also an automatic assessment of bipolar disorder based in audio-visual cue. In this work, we have been focusing only on audio signal, but we hope to develop a multimodal approaches. We want also to develop a new AI technology for a better follow-up of the patient. So we have already proposed such approaches for clinical depression, and today we want to go further for bipolar disorder. Okay, so in this work, we have proposed deep learning-based approaches for bipolar disorder using audio signal. So we start by a pre-processing approach, which improve the quality of the signal, delete noise, and so on. We do also windowing, and for the window, for this approach, we consider between 10 seconds and 30 seconds, the length of each signal. We do data augmentation by adding noise, shifting or scaling, and so on. We want for future work to use GAN to generate new ones. After that, we propose a general feature extractor based in CNN, and then we feed this extracted feature to a transformer. And after that, we classify into one of the three classes of the three episodes of bipolar disorder. Okay, so for our experimentation, we have used a data set which is proposed of a Turkish population. In this data set, we have 120 patients, 46 patients have been released and made publicly available in AVEC challenge. From these 46 patients, we have 218 audio recorded, and for this research work, we focused only in using speech, but we are planning to use other modality. So here we have three classes. The first class is when the score of the questionnaire, the inventory questionnaire Young Mania rating scales is below 7. We are talking about remission. When it's between 8 and 19, it's hypomania, and when it's above 20, we are talking about mania phase. Okay, so our population, it represents 100% of people who have affected by bipolar disorder. So we have 35% of this population which are women and 65 which are men. We have 30 men in our data set, the one that we have used. So we have evaluated our approach by varying several parameters of our deep neural network. The best one is in the last line. So our word-to-vec, it gives 88.20%. By considering a max length of our window of 30 seconds, a batch size of 4, and 16 number of epochs. So here we have evaluated our approach by using our metrics. So we can see that according to the F1 score, recall, precision, and accuracy, all of them, they are above 87%. So our approach is very accurate. No overfitting has been proposed. When we compare our proposed approach with other state-of-the-art approaches, we outperform all existing approaches in AVEC 18 BD database or data set. So other approaches, they use raw audio signal that they feed directly to a deep neural network, or some of them, they extract low-level features like MFCC coefficient, and then they fed it to a recurrent neural network. So our transformer-based approach, it outperforms all existing approach instead of the art. So in this work, we have proposed a new approach for BD diagnosis and classification using audio. So our approach, it outperforms all existing approach. For future work during the PhD thesis of my student, we are planning to propose a multimodal approach for bipolar disorder diagnosis. So we are planning to use audio, visual, so facial landmarks, textual pattern. We want also to use EEG to analyze the brain activity, and we want to propose a remote monitoring system to follow patients when they are home and between the medical visits, because there is a big gap, and usually the medical visit is so far away, and sometimes there is interruption in follow-up. So we want to fill this gap. So thank you for your attention, and I'm hiring postdocs. So if you are interested, do not hesitate to send me your CV.
Thank you. Let's move to the next presentation. Thanks again. Our next presenter is Roman. He is a young